I think most of us in dermatology, and this is certainly true for myself, went into the field, or one of the reasons we went into the field is because our field is so diverse. And while there are some dermatologists that identify themselves as being a cosmetic dermatologist only, or a surgical dermatologist only, or a medical dermatologist only, I think really most of us do a mix of everything, because that's what maybe attracted us to dermatology in the first place. And I think that if you'd like to transition your practice from being a strictly medical dermatology practice to a medical and cosmetic dermatology practice, and this is certainly current for me because that's the transition that I've taken the past several years, I think it's important to really realize what cosmetic procedures you want to offer, become good at performing those procedures, really train yourself and your staff to do those procedures, and then offer those procedures to your patients. And I think most dermatologists out there will say, well, I do a little bit of toxin injections, and I'll do a little bit of fillers, and I'll do some lasers. So you really have to pick the things that you like to do, that you enjoy doing with your patients, and things that you want to improve on and you want to be good at, because if you're gonna offer a procedure, you really have to master it, because otherwise there's no reason to really offer, because somebody down the street could probably do a better job than you can. So if you're transitioning your practice from strictly medical to a mix of medical and cosmetic, I think it's really important to not offer everything at the same time in the beginning, to really sort of learn your craft one by one. So maybe really learn how to do toxins injections correctly, and there are techniques in their courses that you can take. To then maybe learn how to do fillers. Do you want to do mid-face? Do you want to do temples? Do you want to raise eyebrows? Do you want to do lips, etc., and really become good at those? And then maybe do you want to add a resurfacing laser to your regimen? So do you purchase a laser and then offer it, or do you first assess the need in your practice for something? Would your patients want to go for it? Because the last thing that any of us want to do is invest time and money into something that's just going to be sitting in the corner of our office collecting dust. So there's lots of different things that need to be considered if you're transitioning. But I think most importantly, it's something that you have to enjoy, and if you think that your patients would want to come to you for those treatments, you really have to learn how to do them and really become an expert, just like we become experts in treating psoriasis, acne, eczema, etc. Doing toxins or filler injections or doing laser procedures is no different. So you really have to spend the time, learn the craft, and then offer it to your patients so that you could have good outcomes and you could have your patients refer you their friends and family and grow that part of your practice. I think if you're transitioning a practice from a strictly medical or surgical to a medical, surgical, and cosmetic practice, it's very important to know if your patients will be interested in the procedures that you may or may not offer. So I think it's easy to buy some toxins and fillers and start offering because the startup cost is really fairly low. But if you're going to be offering things like liposuction or laser resurfacing or laser therapy, it's very important to know from the beginning that your patients will or may be interested in those procedures, and really have the resources for you to make it worth your while to invest your time and money into buying that equipment. So I think it's really important to just have a conversation with your patients, some of the patients that you've known for a long time that you think would benefit from those procedures. Would you be interested if I bought a fractionated resurfacing laser and we can get rid of all your melasma and freckles, or we could try to work on those etched in lines or the acne scarring that you've had from 30 years ago? Is that something that you'd be interested in? I'm thinking about charging this much per treatment. Do you think that would work in this kind of a practice? And I think having that information is really important, as opposed to just buying a bunch of equipment and saying, oh, you know, if you build it, they'll come, and then if they don't come, you really have made a bad investment and a bad choice. So I really think it's important to understand what your practice is like, what your patient demographics are, and really see if you can market. It's all about marketing, really, your practice, and transition it from a medical practice or a surgical practice to a mix of all, including cosmetics. When offering cosmetic procedures in your practice, or beginning to offer cosmetic procedures in your practice, it's very important to understand what the startup cost is, because that will determine ultimately if it's successful and how much you can charge for each procedure. So if you're starting to offer toxins or fillers or lasers and you're not aware what the cost that your market would bear is, I think it's really good to call around the offices that are in your area and see what they're charging, if you know that they're doing a procedure as well, because you're probably going to be right in that same ballpark. So if somebody's charging $800 for a syringe of a hyaluronic acid filler, it's unlikely that you'll be able to charge $1,200, or you probably shouldn't charge $400. So it's really important to sort of be in the same ballpark as your competition, so to speak. So when determining whether or not to add something new to your practice, it's important to figure out whether or not it's going to be financially worth it to you, and whether or not you're going to enjoy the interaction with your patient about offering that new procedure. So not only do you have to figure out what specific procedures to offer, but also you have to figure out what the startup cost is and what the profit margin really would be, and is it worth it to you to invest your time to build this up and then to actively market it to your patients. And all of these factors, I think, are vital in really understanding how to transition your practice from a strictly medical or strictly surgical to a mix of medical, surgical, and cosmetic. One of the reasons I was interested in pursuing a cosmetic dermatology practice is I believe that it can help my medical dermatology patient in conjunction with the therapies that I'm already using. So for example, I take care of a lot of severe acne patients that we use isotretinoin oral or blue light or other therapies, and I really believe that offering a resurfacing laser to improve the scarring that they may have from their prior acne helps me take better care of the patient as a whole. Same thing with rosacea. If you have a vascular laser that can help with broken capillaries or overall erythema, and you're already treating a patient with oral antibiotics or topicals for rosacea, it really becomes a more complete treatment approach. So I think it's important to be able to integrate the treatments that you may want to do from a cosmetic point of view in your practice with the medical treatments that you're already doing. And I think that's actually one of the ways that you can assess whether or not adding a certain procedure to your practice will be successful. So if you have a waiting room full of acne patients, most likely some of them are going to need vascular laser or resurfacing laser to help with some of the after effects of their acne. Or if you have a large surgical practice, maybe resurfacing laser, fractionated resurfacing laser will help with some of the scarring that your patients may get. So really try to integrate your medical surgical practice with the cosmetic procedures that you offer, I think will make the practice more successful. In conclusion, when transitioning your practice from a strictly medical or surgical to a mix of medical, surgical, and cosmetic, I think it is important to know what your patient demographic is and to really know what you're good at and what kind of patients you already have in your practice, so you can try and integrate the cosmetic procedures that you may want to offer with the medical or surgical treatment that you're already doing.